You're listening to the Health and Happiness Podcast with Travis Kemper and
Lauren Maxwell. Each episode, we share easy to implement strategies to improve your health, happiness, and overall quality of life.
You are only as young as your spine is flexible. Joseph Pilates. How's it going, Travis?
Good. Duke is loving the snow and cooler temps. I think I've said this before, but my new work schedule is awesome. And, well, I think that's all I have to report right now. What's up, Lauren?
Things are going good. I mean, I guess I'm a little sick right now, which kind of stinks again. But I'm hoping this sickness doesn't last quite as long as my previous one because it feels like I was just sick. Although, I guess it was a couple months ago, but whatever. It's not fun to be sick, so. Anyway, we're excited for our first Halloween at the house. Tomorrow is Halloween. I think we're almost done getting our front yard all set up, and we've got our costumes all ready, except for Keely's, which I have to make today. I don't know if I've talked about what costumes that we're going to be wearing on the podcast yet, but we're going to be Hocus Pocus theme. Yeah, it's going to be fun. So me and my friend Jamie and her dog are going to be the three witches, and then Nolan is going to be Billy, and then Keely is going to be the book, so I can yell book, and then she can come running. It's going to be cute, but I have to make her costume. Anyway, we're super excited. And somehow I've already had my student for 5 weeks, which is insane.
Nice.
Because we just completed our midterm assessment on Friday, and it's like, I don't know, mind-blowing to me that she's already halfway through her rotation. It's by no means an easy rotation, but she's doing super well, so I'm proud of her. What are we going to talk about today, Travis?
Stretching and the benefits of it.
Nice. So, what is stretching? Stretching is when the muscle fibers and tendons are put into a position of lengthening where the proposed benefits include an increased joint range of motion, decreased muscle tightness, increased muscle length, decreased pain, and improved circulation. There are 3 different types of stretching that can be performed: static, dynamic, and proprioceptive neuromuscular facilitation, or PNF stretching. Static stretching involves moving the muscle or joint into a lengthened position and holding that position for an extended period of time. In the past, this type of stretching was used to prepare the muscles for exercise. However, current research has consistently demonstrated a reduction in muscular power immediately after static stretching. As a result, this type of stretching is reserved for post-training recovery or on non-training days. The only exception for pre-training static stretching would be for rehab purposes, recommended by a health practitioner. Dynamic stretching is when soft tissues and joints are taken through their range of motion during movement. This type of action is more specific to preparation for exercise and sports in particular. Dynamic stretching has been shown to significantly increase tendon elasticity and flexibility. This type of stretching technique is not recommended during the rehabilitation process. However, it has been promoted for end-stage rehab for tendon injuries. Care should be taken when performing this type of stretch, as it involves eccentric contractions, which may result in soreness or injury if performed too forcefully. PNF stretching involves the combination of excessively stretching the target muscle and contracting the opposite muscle. This type of stretching method is particularly aggressive but can result in rapid increases in flexibility.
So stretching is important because it keeps the muscles flexible, strong, and healthy. And we need that flexibility to maintain a range of motion in the joints. Without it, the muscles shorten and become tight. Then, when you call on the muscles for activity, they are weak and unable to extend all the way. That puts you at risk for joint pain, strains, and muscle damage. For example, sitting in a chair all day results in tight hamstrings in the back of the thigh. That can make it harder to extend your leg or straighten your knee all the way, which impacts your walking. Likewise, when tight muscles are suddenly called on for a strenuous activity that stretches them, such as playing sports, they may become damaged from suddenly being stretched. Injured muscles may not be strong enough to support the joints, which can lead to joint injury. Regular stretching keeps muscles long, lean, and flexible. Excuse me. And this means that exertion won't put too much force on the muscle itself. Healthy muscles also help a person with balance to avoid falls.
So the benefits of stretching include improved energy, increased stamina, improved flexibility, better blood circulation, improved posture, decreased muscle soreness, improved cholesterol, maybe a decreased risk of injury, and decreased stress.
So we're going to briefly summarize some of the research. There's a lot of research on stretching, and it is less than conclusive. At some point in our lives, we have all engaged in some form of stretching to reduce stiffness and pain or increase flexibility and range of motion. However, much of the current information regarding the benefits of stretching appear to be conflicting with research supporting and rejecting the suggested benefits. A 2012 study on stretching concluded the following. The benefits of stretching seem to be individual to the population studied. Several factors must be considered when making clinical recommendations from the literature. To increase range of motion, all types of stretching are effective, although P and F type stretching may be more effective for immediate gains. To avoid decrease in strength and performance that may occur in athletes due to static stretching before competition or activity, dynamic stretching is recommended for a warm-up. Older adults over 65 years should incorporate static stretching into an exercise regimen just for healthy living. A variety of orthopedic patients can benefit from both static and pre-contraction stretching.
So, does stretching prevent injuries? Well, turns out there's also evidence that discredits this benefit. Multiple studies have shown that stretching of all types did not reduce injuries significantly at all. Does it improve performance? Some sports require a large amount of flexibility. In these sports, stretching helps achieve optimum performance. A 2007 study also noted that stretching for several weeks improved muscular strength despite no dedicated strength training being performed.
I have personal experience from my mid-20s when I became really dedicated to stretching and noticed subsequent substantial strength gains.
Awesome. However, in the majority of studies, stretching immediately before exercise, particularly stretching the same muscle group for more than 120 seconds in total, aka static stretching, reduces the maximum amount of power that muscles can generate and can be detrimental to athletic performance. A 2013 study also found that strength training programs that are preceded by flexibility training or where stretching is executed between the sets or lifts are likely to make smaller gains in strength as compared with performance of strength training alone.
Which is exactly the opposite of my experience.
They recommended that strength training and conditioning professionals who desire to include static stretching into their sessions should consider implementing it at the end of the session and use a dynamic or specific warm-up before training.
But Lauren, a 2007 study suggests that chronic static stretching exercises by themselves can improve specific exercise performances. They conclude that it is possible that people who are unable to participate in traditional strength training activities may be able to experience gains through stretching, which would allow them to transition into a more traditional exercise regimen.
That's awesome.
The 2021 study compared 7 minutes of static self-stretching exercises to 7 minutes of foam roller self-massaging on trunk range of motion and trunk extensor strength. They found that both were equally effective in acutely increasing the range of the trunk movements. However, the foam rolling group also experienced an increase in strength of the trunk extensors following the self-massage. So some evidence, solid evidence for foam rolling in that study.
Yeah, that's really cool. I love foam rolling.
I never do it.
I
Very
love
rarely.
it.
I did it this morning after I just said I never do it.
It feels so good.
Yeah.
Never do it except for today.
Except for today, of course.
Does stretching decrease pain? A 2017 study showed that increased flexibility was actually associated with a greater tolerance for pain, which occurs during the stretching. It's possible that stretching actually impacts pain perception by activating the areas in our central nervous system that modulate pain. A more recent study delved a little further into this idea. 22 healthy adults who did not suffer from back pain were recruited for this study. Each participant was asked to perform a stretch of the lumbar region, which is the lower back, followed by a stretch of the forearm muscles. Participants were instructed to hold each stretch for 3 minutes to produce a moderate stretching sensation. That's a long stretch.
That is way longer than I ever hold a stretch.
I can barely make it to a minute most of the time.
Yeah.
They observed that both stretches produced hypoalgesia, an increase in the pain sensitivity threshold. In other words, after the participants performed the stretches, the experimenter had to apply greater pressure to produce pain. Following the wrist extension stretch-induced hypoalgesia was restricted to the wrist and forearm itself, while following the back stretch, hypoalgesia was also present at a distance from the stretched area. So they noticed that it affected also the forearm. So they were able to stretch the forearm more in addition to the back after the back stretch, which is interesting. Yeah.
So in the literature, conflicting data have been reported concerning the relationship between flexibility and athletic injury. Stretching recommendations are clouded by misconceptions and conflicting research reports. The literature reports opposite findings from different samples. Part of this contradiction may be explained by considering the type of sport activity. Sports involving explosive skills require a muscle tendon unit which is compliant enough to store and release the high amount of elastic energy. Recently, it has been shown that stretching is able to increase the compliance of human tendons, and as a result, increase the capacity of the tendon to absorb energy. Consequently, in these sports, research suggests that stretching is an important prophylactic measure for injury. A 2022 meta-analysis reviewed the literature concerning evidence-based hamstring training to quantitatively assess the effectiveness of training programs in 1, reducing injury incidence, and 2, managing injury risk factors. They concluded that eccentric strengthening reduces injury incidence and improves hamstring strength, muscle fiber length, hamstring and quads ratio, and limb asymmetry, while stretching-based interventions can be implemented to improve flexibility. So they found that eccentric strengthening was the primary factor for reducing injury incidence in hamstrings.
So does stretching have any effect on balance? A 2021 study found that longer-term stretch training can improve balance, which may contribute to a decreased incidence of falls and associated injuries.
Some other possible side effects. One would be a reduction in blood sugar levels for diabetic patients. A 2022 randomized control trial demonstrated that static stretching showed significantly improved blood sugar levels for people with type 2 diabetes. According to the study, the most likely explanation is that static stretching of the skeletal muscles produces an alternative to exercise that helps people with diabetes control their blood sugar levels. Static stretching increases the amount of heat and oxygen consumed by the muscles, and due to the integration of the glucose transporter type 4 into the stretched muscle, it enhances metabolic activity in these muscles and lowers blood glucose levels. So basically, stretching requires energy. Your muscles are using the sugar, and therefore you're lowering the blood glucose levels. Not a huge jump to conclude that, but awesome.
Not a huge stretch, some would say.
Oh, man.
So there has also been some research on stretching and intraocular pressure. So thus far, intraocular pressure is the only modifiable risk factor in glaucoma. Exercise is a potential modifiable risk factor in many chronic diseases, especially on disease control and quality of life, and may have a potential beneficial effect on glaucoma patients. However, the effect of exercise on intraocular pressure remains controversial because I guess exercise can at times increase intraocular pressure, and you don't want that for glaucoma.
Makes sense, especially if you perform a Valsalva.
Yep.
Which is like when you hold your breath and push, basically.
The challenge for this population, therefore, is to choose safe and effective exercise without causing elevation of intraocular pressure in glaucoma patients. A 2020 study found that chair-based stretching exercise was a safe and easy way to practice among the elderly, especially those with advanced visual field deficits.
So in conclusion, in practice, I use stretching every day for myself and my patients, and it helps a lot with soreness and pain modulation in my experience. The research is largely inconclusive, but what is rather substantiated is that static stretching before exercise does not decrease acute injury, but does decrease maximum strength when lifting right after stretching. So if you plan to max out, a dynamic warm-up is better. If you don't plan to max out, stretch whenever you'd like.
Yeah. So where can we start? With a full body of muscles, the idea of daily stretching may seem pretty overwhelming, but you don't have to stretch every muscle that you have. That would take forever. The areas critical for mobility are in your lower extremities, so your calves, your hamstrings, your hip flexors in the pelvis, and the quads in the front of the thigh. Stretching your shoulders, neck, and lower back are also pretty beneficial. Aim for a program of daily stretches, or at least 3 or 4 times per week. There is a cumulative effect of stretching. Just like you don't get tight muscles overnight, you also don't get flexible after just 1 or 2 days of stretching. It's something, I know, imagine that. It's something you have to work on often to achieve and keep it up to maintain. Or I guess some people can just be born bendy like me.
Maybe she's born with it. Maybe it's a stretch routine. Lauren, this was fun.
This was super fun. Nice
You
job.
did a great job. Thanks everybody for listening. We'll see you next time.
See you next time. Bye.
Bye.
Thank you for taking the time out of your busy day to listen to this episode of the Health and Happiness Podcast. We hope you enjoyed the episode and are getting benefits from our content.
If your life is improving in part due to the information in this podcast, we would greatly appreciate you sharing the episode with your family and friends on social media and leaving us a review so we can continue to reach more people and improve the health and happiness of the community at large.
Thanks again, and we will see you next week for another episode of the Health and Happiness Podcast.